Hi, I'm Tara Johnson and I'm a nursing student. I'm going to be doing my skills testing or skills for medication administration, and I'm going to be giving an oral medication, a transdermal, and also an optical eye medication. So I'm going to do my hand typing here at my nursing cart, and then I'm going to take the doctor's orders and compare them to the MAR that I have in the system. And then, okay, so I'm comparing the eye medication to what I have on the MAR, and it says 3 times daily with a 9 a.m. Right now it's 9 a.m. It's refresh when we're getting drops. The second medication is going to be a transdermal patch, fentanyl 50 twice daily. So it compares to what I have on the MAR. And then the third one is going to be Augmentin, 600 milligrams by mouth twice daily for 7 days. It compares to what I have on the MAR, and I did the dimensional analysis and figured out how many milliliters I need to give of the medication. And ibuprofen is also on here for as needed, 800 milligrams by mouth every 8 hours. It's a PRN, so I'm going to assess the person for pain first before administering that. And then the last medication I'm going to give is digoxin, which I did the dimensional analysis on it, and it matches the MAR here for once daily at 9 a.m. Then I'm going to check the allergies, and I have an allergy to codeine and promethazine. And then I'm also going to see if they have any swallowing restrictions, because some of the medications are oral and there's nothing here. And then I'm going to go through my seven R's to make sure that everything's okay for the first check off. And everything seems to be fine with the 7 R's. And okay, that's for my first check. I'm going to knock on the door, talk to the patient. Hi, Shirley. I'm just going to check you here to see your wrist bracelet to see. Okay, we have your allergies on this one, promethazine and codeine, and your date of birth, Shirley Cost, and date of birth, 4/3/87, which matches what I have in the hallway on your MAR. How are you feeling today, Shirley? I'm just going to do a little bit of an assessment on you before I give you a medication. I'm going to check your pulse for a minute here. Okay. I'm going to check your pulse for a full minute. Okay, and your pulse is 75, it's above 60. I'm just going to listen to your lungs here. So if you can do a couple deep breaths in the 4 areas. And then I would also check on the back, 4 areas. And then I'm going to assess your legs for any swelling, for edema. It looks pretty good. Doesn't appear to have any swelling. Are you having any pain, Shirley, today? Oh, in your lower back? Okay. And how long have you had that? And what causes it? Oh, okay. So how long would you say you've been having lower back pain? Okay, so on a scale from 1 to 10, what would you say that your pain in your lower back is right now? Oh, a 6? Okay. So you also have some ibuprofen. Would you like to have that now for your back pain? Yes? Okay. Okay, here's your hallway, and I'll be back with your medications. Hand hygiene. And then I'm going to do my second check here. So I would put gloves on when I'm preparing the medication. Okay, so I'm going to start with the refresh drops here. And it looks like the expiration date's good on those. And it matches with the, well, it matches with the Mars's here. So I'm going to administer a drop in each eye, both eyes. And I'm going to keep this medication in the cart because we wouldn't want to take that in the room with us. Okay. And then the second one will be my patch. So I'm just going to get my piece of tape ready for my patch as well. And I'm going to compare my patch to what it says on the MAR 50. Microgram. Yep, and it compares to what's on the MAR. Piece of tape. Okay. My next thing would be the Augmentin. Oh, that's 2 nice cups together. That's not. Okay, I'm going to go eye level. I'm going to take my alcohol pad. I'm going to burn that. And then next I'm going to get the ibuprofen. And these are 400 milligrams, so you can have 2. And then lastly, I'm going to have my digoxin, and that matches what I have in the MAR. Okay. So everything I have in my tray matches with this, and then I'm going to remove my gloves before I leave the hallway and go into the room. So So this stuff is gonna go back into the cart. And this is my pretend cart in the hallway. And then I'm gonna take the tray into the room, and I'm just gonna take this cart because there's not anything else to use in the room here to set it on. Okay. Hi, Shirley. So I'm gonna put on new gloves now. And actually, I wanna check Shirley's pulse again before I put gloves on. So I'm gonna check your pulse again before I give you your medications for a full minute. So I checked Shirley's pulse again for a full minute. But for video purposes, I'm only gonna do it for 15 seconds this time. Okay, and her pulse still is above 60, so Shirley, are you still having pain? Yes? Okay, what would you rate your pain? Oh, it's a 7 now, okay. So I'll give you the ibuprofen, and then I'm gonna take this scanner here and check your ID bracelet. Okay. Then that would scan up her name and her date of birth information. Okay, and now I would put my my gloves on here. And then I would also do my 7R checks again. This is the third check now, so I would check my 7Rs again to make sure that I have everything right with those. Okay, so the first thing that I'm going to give you here, Sherry, is Augmentin. It's for your pneumonia. Would you like some water along with that? Yeah, water? Okay. And then Shirley, here's your ibuprofen for your pain. Your water? I'm going to have one more pill here for you. Compare that to the Narcan into digestion. And I would have compared the ibuprofen on there too before I gave it. Here's the digoxin. And some water. Okay, and then I would change my gloves to do her, have new gloves on for her eye medication. I'm just gonna put your head down a little bit for your eye medication. I can hear it now. Okay. Oh. I can figure out where the down button is here, Shirley. Okay, now I'm going to take my washcloth and get it wet in the sink here and then clean her eyes out with just regular water, no soap. Okay. I have your eye drop here, Shirley, so pull the lid down, put it in, pull the lid down, put it in. Okay, open the packet. And now I'm going to change my gloves. I'm going to clean pair of gloves and put her transdermal patch on. Compare that with the MAR. The eye drops I didn't compare with the MAR either, but the patch is the same here as well. Okay, so what I'm gonna do first is I'm gonna take her old patch off. And then I'm gonna take that and fold it in half. Okay. And then I'm gonna wipe that area with that alcohol wipe. Clean it. And put the patch in the sharps box because it's so can't go in the regular trash. And take a look at the type of medication that it is. Okay. So I'm gonna prepare the patch. Put my tape on it with the date and my initials. I'm gonna have another alcohol wipe with me, so I'm gonna rip that open, and then I'm gonna clean the area before I put it on there. Okay. Shirley, are you comfortable? Oh, you want your head up? Okay, sure. I'm gonna come back in 30 to 40 minutes to see if your pain has lessened at all, since you have a new patch and got the ibuprofen. So I'll be back in 30 to 40 minutes then. And here's your call light. Is there anything else that you need from me? Oh, okay. Then I would perform my hand hygiene. And then I would do my proper documentation. Sign for the meds that I gave on the MAR. And then I would come back in 30 to 40 minutes to check on Shirley to make sure she's not having any pain. And then I do my hand hygiene before I leave the room and gather my supplies that were in the room with me, take everything out. And return it to the med cart. Oh, oh my gosh. I'm not knocked the door down. It's on the floor. That's it.